We've been saying COVID-19 absolutely central to today's commemorations and also to what the president said in that interview. Well, let's bring into the conversation epidemiologist Catherine Hill. Catherine, we heard from the French president a short while ago saying he is in favour of face masks being worn in all public enclosed spaces here in France. Now, are you in favour of that idea? And if so, what's your reasoning?
Well, masks are not a bad idea, but it's the second best solution. Prevention of a contagious disease. The best prevention is to find the people who are carrying the virus. And that is done by tests, by virological tests, done by putting something up the nose and trying to see if there is the virus in the back of the nose of the person. And that would allow to isolate all the carriers of the virus and prevent the continuation of the epidemic. And that is not done. So masks are really a second best option. And I don't understand why they're not trying to test massively the population. It's feasible. One can do group testing and test 10 people or 20 people in the same vial. And if the virus is not very widely present, a lot of these 20 people tested at a time would be negative. And then you will have to retest if the result is positive. You know, at least one of the 20 is positive. You have to test them one by one. But really, if you want to control the epidemic, you have to find the carrier of the virus. The nasty thing with this virus is that there are asymptomatic carriers. And the only way to find them is to test massively.
Okay,
That's what has been done in China, wherever the epidemic has been controlled.
All right, so you're saying masks are the second best solution. Testing is the number one solution to this problem that we confront ourselves with. Let me just pick up on the issue of masks, since that is so central to what the president said. For someone who's watching, who isn't convinced, who says, why should I wear a mask? What's your message?
You should wear a mask because if you are positive and you don't know it, you are spitting the virus all around you. So you should wear a mask. And you should wear a mask so the person in front of you who is positive and doesn't know it is not spitting virus in your face. So you should wear a mask so the people who are positive and do not know it are also wearing a mask. That's the main reason.
OK, and just lastly, very briefly, because we're almost out of time, the president hinted that we could be on track for a second wave of COVID-19 here in France. Are you seeing any evidence of that?
The epidemic has never been controlled. It went down very markedly because of lockdown, etc. And it's now at a, low level of contamination, and it's beginning to pick up again. There are more called to visit to the emergency services, etc. So there are hints that it's spreading again. And because people are traveling more, it's the summer, they were going on vacation, they're moving from areas where the virus is more frequent to areas where the virus is not as frequent. And, families, they haven't seen each other and they meet again and they have family parties. All that is a reason for more circulation of the virus. And one can see that, one is beginning to see that.
OK. All right. Well, thank you so much. I'm sorry, we're going to have to leave it there. Epidemiologist Catherine Hill, thank you very much indeed for speaking to us. In the